Now, one of the common muscles that gets involved with the compensation as a result of arthritic pain is the glute maximum. This happens with other syndromes as well. They call it gluteal amnesia. In other words, that muscle does not start to fire or contract properly, causing problems. Mike, do you want to explain how it all works?
So what can happen, there's an array of issues can happen from weak glutes. One is known as femoral anterior glide syndrome, meaning the head of your femur here actually gets pushed forward or anterior in the acetabulum or the hip socket joint here. This can lead to a lot of pinching sensations, pain issues, more arthritis developing. Other issues that may happen from weak glutes is actually a valgus knee stance. So that can mean your knocked knees or your knees point in together. Some people, it can actually do varus depending upon the individual and how they look. Also, if your glutes are weak, you can actually lock your knees, which is also problematic for arthritic people.
That's right. Puts the joint at end range, we call it, and more force goes into that joint, causing bone-on-bone problems eventually. So I did want to mention, we're talking about glute maximum, that big muscle right in the back. The other ones are involved as well, but that's the primary muscle. All right, we're going to start out showing how to do this exercise properly. We're going to do it from a sit to stand, which is essentially a squat, but it's for someone who has pain or is a beginner and doesn't have the strength. Mike, can you go ahead and show the details?
So you want to start sitting in a chair, have a 90-degree bend in your legs, and say we're going to work both sides individually. So we're just going to start working my left side first.